And we're concluding the Australian Cannabis Summit for another year, but not without a case study mashup. All of our doctors who have presented on the panels over the last 2 days will be presenting case studies from their own clinics, things that they have seen and results they have seen within their patients. Here is all of our doctors. There's too many to name them, and thank you to them all with their case study mashups.
Hi, I'm Dr. Orit Holtzman, and I'm the Vice President of the Australian and New Zealand College of Cannabinoid Practitioners. Together with our President, Dr. John Teh, and our directors, Dr. Gal Herzberg, Dr. Imran Khan, and Maya Lapkovic, I'm very excited to invite you to join us as members. We have founded this college to fill in a very pressing need for standardized education and peer support for healthcare practitioners in the field of cannabinoid medicine. Our vision is to advance the practice of cannabinoid medicine so to better the lives of patients. To join us, go to www.anzccp.org. I look forward to seeing you there and enjoy the rest of the symposium. Hi, I'm Dr. Orit Holtzman, and I would like to share a case study with you today on the topic of neck dystonia and chronic pain. So Richard is a 67-year-old man that presented to me with a long history of neck pain and headaches that became more intense in the past months before coming to see me. So he's seen a neurologist about 3.5 years ago and initially was diagnosed with Parkinson's. However, L-DOPA was not beneficial and he was referred to a movement disorder specialist that diagnosed him with cervical dystonia and possible Parkinsonism. Botox injections to the neck were tried. However, when the dose was increased in order to reach an effective dose, he developed issues with swallowing, and the injections obviously had to be stopped. His other symptoms were tinnitus and tremor and tunnel vision. Comorbidities were hypertension. And his medication on presentation were Lyrica, mirtazapine, Coversil, and also, interestingly, black market cannabis oil. So really he was having severe pain and symptoms until he started on the black market cannabis oil quite a short time before coming to me. The concentration of this was unknown. However, he was told that he was taking 7 drops of a high CBD oil with 2 drops of high THC oil. Since starting on those drops, his headaches, neck pain, and tinnitus were completely gone. Unhelpful medications that he tried in the past were Voltaren, pregabalin forte, Palexia, and Endon, and he was allergic to penicillin. Non-pharmacological interventions that were tried were acupuncture, chiropractor treatment, massage, meditation, and supplements. So at the initial consultation, we covered his history, his expectations from the treatment, the fact that it's an unapproved product, possible side effects, his responsibilities, and he also signed a consent form. Also performed an assessment of his pain on a pain scale, and without the cannabis oil, he rated his pain as 9 out of 10. This case was quite challenging for me because this patient was already having a very good result from black market oil. And of course, I didn't want to make him any worse. So I tried to find a product that would mimic what he was possibly taking. So since it appears that he was taking a high CBD, low THC combination, that's what I prescribed for him. So a product with a ratio of 1:20, 1 milligram per mil of THC with 20 milligram per mil of CBD. And I started him on a low dose of 1 mil at night that would only contain 1 milligram of THC. And with instruction to try him up every 5 to 7 days by 1 mil. After 10 days, I received a phone call from him. He was now taking 1 meal twice a day. However, all his symptoms returned. He was in pain, the neck dystonia returned, and he was feeling very anxious about all this. So Of course, I was quite unpleased with that, as was Richard, although he was very understanding, and we decided to increase his dose in order to reach a therapeutic dose. So we increased his dose to 2 milliliter BD. On this dose, his back pain was relieved. His dystonia initially was relieved, but then returned, and he was not feeling like himself. However, he felt that the dose increase was helping. So we increased his dose further, first to 2 ml in the morning and 3 ml at night, and then 3 ml in the morning and night for about 3 days, and then I advised him to call again. On 3 ml twice a day, his pain and dystonia have significantly improved. However, 3 meals in the morning felt like too much to him, and he decreased his dose to 2 ml in the morning. He was still not feeling exactly like himself. So I advised him to reduce his morning dose further. We decreased his dose to 1 meal in the morning and 2 meal at night. On this dose, his dystonia was gone. He was feeling very well. He was still taking Lyrica as well. And on this dose, he rated his pain as 1 out of 10. So that is a very significant reduction. Now, however, he was taking in total a dose of 3 meals a day. So while it was effective, this ends up to be quite costly as the product would not last for very long. So I advised him to change his nighttime product instead of a 1:20 ratio to an equal THC to CBD containing product. So the equal THC to CBD usually allows patients to take a much lower dose. So we were able to decrease his dose to 1 meal in the morning and 0.2 instead of 3 meals at night. On this dose, his dystonia was gone still. He was feeling very well, and he was able to cease Lyrica and was weaning off mirtazapine. His pain was still rated as 1 out of 10. Now I'm still seeing this patient. He's doing very, very well. Actually decreased his morning dose to 0.5 ml in the morning of 1 to 20, and he's taking 0.3 ml of the 1010 product at night. Still not experiencing any symptoms. However, he was started on Cifrol by his neurologist, as he probably does have Parkinsonism. So I hope you enjoyed this case. As I said, it was quite challenging for me, but the outcome was very satisfying, both for the patient and for me as well. So I hope you'll enjoy the rest of the symposium, and thank you for your time.
Hi, welcome back to the Australian Cannabis Summit. I'm Dr. John Teh, Medical Director of Plant Med, Brisbane, Australia. This is my second case study for the conference. I'm going to look at treatment-resistant pain in this case, a young man who was involved in a severe motor vehicle accident. So here we're looking at the case of a 29-year-old male from rural Australia, was involved in a severe motor vehicle accident and had multiple trauma and has severe treatment-resistant pain. So there was this young man, LP, was involved in a major motor vehicle accident in July 2018. Sustained 23 fractures to his pelvis, 7 fractured ribs, 5 spinal fractures, a sacral fracture, right lung pneumothorax, crush injury to the left hand. As a result of this accident, he suffered severe anxiety and PTSD surrounding the event. Initially, he was wheelchair bound, and after extensive rehab, he has gotten mobile again. He presented to me initially about a year after the incident on the 2nd of the 5th, 2019. At this point, prior to this, the patient was on a cocktail of conventional pain, sleep, anxiety medications, which he had weaned himself off of. There was issues about addiction and dependence occurring. And his pain was quite severe, 8 to 10 out of 10 at all times. Had chronic and active PTSD with anxiety and night terrors and bad dreams about the accident, and sleeping very poorly, awakened from pain very regularly. So as you can see here, this was a serious incident. There's the vehicle on the left and an X-ray image of his pelvis after major reconstructive surgery. At the time of the consult, the patient was still on escitalopram, Seroquel, and temazepam. So dealing with the depression and anxiety and PTSD surrounding his motor vehicle accident. Medications which he had ceased prior to this were tapentadol at 100 milligrams twice a day, tramadol 100 milligrams 4 times a day, endone 20 milligrams 4 times a day, paracetamol 1,000 milligrams 4 times a day, pregabalin at 75 milligrams twice a day, diazepam 5 milligrams as required, and Caloxyl and Movicol. With that sort of opiate load, it's very normal to have constipation, obviously. There are excessive side effects to these medications. The patient had major anhedonia. Although the pain was suppressed, his mental state was deteriorating. He felt no will to live. He felt like a zombie, in his own words. He had side effects from all these medications, quite a lot. So he had disturbed sleep. He had rebound pain from the narcotics. He had irritable mood with massive mood swings, excessive constipation, bladder irritability, memory loss, nausea, disorientation, excessive sweating, and had one major hospitalization based on a breakdown associated with his mood and anxiety and depression around this incident. So by the time he'd seen me, he decided to reduce on his own accord, with his help of his doctors, all those medications, because he in his own words said, I'd rather deal with the pain doctor than feel like I was feeling. So obviously this man had severe pain of a known cause. So my plan for him straight away was not to go for the 1:1 oil, but to go for oral oils and a split protocol, so CBD separated to THC. This man was cannabis naive completely. So at this time, we started that dosing regime up with 45 milligrams of CBD 3 times a day and a 20 milligram per mil THC indica oil, which we were titrating up to effect. At a checkup on the 30th of the 5th, the patient had reached a total of 20 milligrams 3 times a day of THC and was having the 45 milligrams 3 times a day of CBD. His pain was decreased, especially during the day, still quite bad at night, but his pain was rated by himself at 6 out of 10. So that's an improvement straight away for this man. Sleep was much improved with 6 hours unbroken sleep, which was a very good result for him very quickly. Anxiety was decreased and still present. So we had a situation where he was taking a considerable amount of THC already and more than enough CBD to balance in this situation. But we are still having, obviously, a lot of pain breaking through this medication. So we suggested a vaporized product, and we started that up with a 20% THC indica variety of dried cannabis using a handheld vaporizer and a dosing rate titrated by the patient. So somewhere between 0.1 and 0.5 of a gram twice a day as required. I saw the patient again on the 18th of the 7th, and he'd had a recent surgical review. And the major orthopedic implication of this was that the bony pelvis was still not united. So there was some slight movement. And obviously the metalwork inside that pelvis was causing considerable pain. Amazingly, his private third-party insurance had come to the table and would sponsor his medication, which they have done since that time, and it's being reviewed currently. Pain was much improved with the inhaled product, so he's coping with the breakthrough pain with that vaporizer. CBD we'd reduced down slightly because it wasn't quite so much necessary, so 30 milligrams 3 times a day. And the THC oil had increased to 30 to 40 milligrams 3 times a day. He was using his vaporizer 3 to 4 times daily, mainly in the evening and afternoon. He was back at work on the farm, and his pain was bearable, rated 5 to 8 out of 10, and he was doing a bit of activity at this stage. So activity would obviously worsen his pain. And he was advised not to physically exert himself, but I think, living in the country in a rural situation, there was certain things that he did need to do for his family's farm. The patient noted great benefit from the cannabinoid medications. And though pain was not resolved completely, there was a marked reduction and a marked reduction in anxiety noted at this time. And sleep had improved again to about 6 to 8 hours nightly. So he was very happy with that. And his mental state from that had obviously gotten better. Although his pain hadn't been completely resolved, he was able to get about his activities of daily living. His anxiety was much reduced. He had reduction in the night terrors and was able to function again for his family and start working. Since the time of writing of that case study, this patient is still my patient. We've added a few different chemovars or different types or strains of medicinal cannabis for vaporization to allow rotation of those medications to reduce tolerance. Dosing on the oils is still approximately the same. We've slightly increased his CBD dose to match his THC dose. And he is using a fair bit of a cannabis medication. He's a high use patient. He has severe pain, and I don't think that pain will ever be completely resolved. And sometimes that can't happen, but he's had a great result. I'm very fortunate that his insurance company has paid for that, and that's being reviewed at the moment. And hopefully this is something which insurance companies will do. And I do see recently one private insurance company in Australia is willing to give some sort of rebates for cannabis medicine. So let's hope that is a trend which continues forward. Cannabis medicine is very useful in this situation. Minimal side effects were noted, and the patient was able to return to normal daily activities. So a great result. Thanks very much. I'm Dr. John Teh, Plant Med, Brisbane, Australia.
So now my next patient is a lady who presented with chronic cancer pain. Her condition was chronic cancer pain secondary to metastatic pseudomyxoma peritonei. Apart from that, she also had renal impairment, atrial fibrillation, gout, mild depression, and she suffered from insomnia secondary to nocturnal pain, and she wasn't allergic to anything. So her medication on presentation included amoxil, escitalopram 20 mg in the morning, metoprolol 50 mg twice a day, Somac 40 mg daily, and Targin 5 mg twice a day. Targin wasn't effective. It wasn't controlling her pain and was causing drowsiness, lethargy. Patient was unwilling to increase her dose due to this effect. So again, we just covered the topics as usual, as per previous presentation, and we applied for cannabis formulation 25 to 25, which was 25 milligram of THC to 25 milligram of CBD per ml. And titration was, we started at 0.1, which corresponded to the amount of THC 2.5 milligram in that product. We titrated by 0.1 every 3 to 4 nights, and her optimal dose was just 0.35 in divided doses, 0.1 in the morning, 0.15 in the middle of the day, and 0.1 at night. So patient again reported pain reduction to 1 to 2 periods of no pain, but also she showed great improvement in sleep, pain tolerance, improved appetite, improved mood, improved overall quality of life. She also stopped Targin, and at the time, at some stage, she was considering stopping escitalopram, but that didn't happen. She didn't report any adverse effects. So patients stayed on this on cannabis for over 12 months. But eventually her condition deteriorated and she passed away in hospital. However, she kept on using cannabis till the end of her life. And as her husband reported, she passed away peacefully. So this is it from me today. And just for further information about our work at Medijuana, you can access us at www.medijuana.com. Thank you.
Howdy again, I'm Matty Moore, I'm a GP from Dunsborough, and I'm talking to you today again about a case study involving epilepsy. This time, it's about a 28-year-old gentleman with resistant adult epilepsy due to a traumatic brain injury. So we'll run through the patient history, the symptoms, the introduction of medicinal cannabis, and the timeline there, the patient outcomes, and the consistent and effective treatment that's continued from this point forward. So this gentleman had a pretty severe motor vehicle accident in 2011, which left him aphasic or unable to speak. He had aggressive behaviors, poor attention, and really disturbed sleep. Diagnoses and symptoms included resistant nocturnal seizures, which caused him to have very poor sleep, which worsened his symptoms during the day, and was a very negative cycle that he was unable to get out of. Previous medications included Epilim, Keppra, carbamazepine, and Lamictal or lamotrigine. And the diagnosis is trauma-related seizure disorder. So as we roll through the timeline in 2019, we introduced medicinal cannabis in August. We commenced an LGP classic 1 and 20 ratio with 1 milligram per milliliter of THC and 20 milligrams of CBD. And we titrated that up slow to 1 milliliter 3 times a day. And that took about a month. So in September, he was up to 1 mil 3 times a day, but still was having seizures at night. There was some improvement, but we decided to get a little bit better. So we increased the 1 and 20 to 2 mils 3 times a day, but yet still was getting pretty broken sleep. It again had improvements, and that was in October. So in November, we decided to do split dosing, which was the 2 milliliters of LGP Classic 1 and 20. That's 2 milliliters in the morning and 2 milliliters in the afternoon. And then we started a 10 and 10 oil, 10 milligrams of THC and 10 milligrams of CBD, and that was at night, and that was 1 milliliter. We slowly titrated him up, and he was on a stable dose throughout November and in December, and remains on 2 milliliters of 1 and 20 during the day, and 1 milliliter of 10 and 10 at night, and that 1 and 20 is a morning and afternoon, 2 mils each. So TBE's family reported improved sleep, behaviors, and general well-being, and he's since started a part-time job, which is great for them. TB has discontinued all of his anti-epileptic medications and he's on his medicinal cannabis oil alone. And I was very hesitant to do this at first because guidelines treatment certainly is to continue those medications and add medicinal cannabis, but the family was pretty resistant, and so we gave it a go, and they were right. It's a great success story. So we're reviewing the effective and consistent treatment. He continues on the 2 mils of LGP Classic 1 and 20, 1 dose in the morning, 1 dose in the afternoon, and a split dose or a different oil at 10 and 10 at 1 mil at night. And this has kept him seizure-free and happy and less agitated. So quite the success story. I hope that you've learned a little bit about resistant adult epilepsy, certainly involving a motor vehicle accident and a traumatic brain injury. So thanks for joining me, guys. Have a great day.
My next case is a 22-year-old mental health patient who had a traumatic childhood. She had a father with poorly managed bipolar disorder and drug and alcohol issues, and a mother with a history of drug-induced psychosis. She had suffered from physical abuse and was hospitalized 10 times during her teenage years for suicidal ideation. Her psychiatrist had diagnosed her with complex PTSD, anxiety, and depression, and had tried her on multiple antidepressants and anxiolytics. She had an allergic reaction to fluoxetine, sertraline was ineffective, and she wasn't coping well on her benzodiazepines. When I met her 3 months ago, she was on quetiapine 100 milligrams at night, desvenlafaxine 100 milligrams in the morning, olanzapine 10 milligrams at night, and lorazepam 2 milligrams as needed at night. Quetiapine seemed to be the drug that was effective, however she'd gained 40 kilos on this medication and she really didn't want to be on this. She had also been seeing a psychologist regularly, which helped her with her symptoms. And prior to seeing me, her treatment plan had helped to settle her anxiety, depression, and insomnia. But she still had a persistent low mood, didn't eat throughout the day, and was sleeping about 3 hours each night, and was frequently waking up with panic attacks. I started her on Little Green Farmer CBD 50 and Little Green Farmer 10-10 hybrid oils, and by her 3-week checkup, her mental state had already significantly improved. She said that she'd finally been able to enjoy herself, interact in group settings, and most importantly, her flashbacks and anxiety were much more manageable. She stopped using her PRN as needed medications. Her sleep and appetite had also significantly improved, and her only side effect was just to have a dry mouth. She's taking 60 milligrams of CBD and 16 milligrams of THC each day, split between 3 doses, and she has improved her sleep significantly with this. If she continues this way, my goal at our next appointment would be to have a discussion with her psychiatrist and to try and wean her off her other psychiatric medications if possible.
Okay, case study number 2. Eva is a 69-year-old lady with multiple sclerosis, had it a long time, has a bit of spasm in the lower extremities, but also gets the shooting pains in her fingers and toes from the multiple sclerosis. Variable at times, variable intensity, hasn't really responded to anything, has tried virtually everything. We're talking Panadol, NSAIDs, opiates, Lyrica, Endep, mirtazapine, and they just cause side effects without causing a decrease in pain or symptoms. Now, this particular patient, this is a neuropathic type pain again. This is nerves causing the pain. So what will we prescribe? This will be a THC to act on those nerves and turn down those pain pathways, those pain nerves. With this particular patient, we're not looking to do a really high dose of THC because most multiple sclerosis patients respond to a very low dose. So particularly in this patient, she's a naive, she's a THC naive patient, so she hasn't had THC before, not using them. So we've used a balanced blend, a CBD to THC, again trying to mitigate any potential THC side effects. The THC that we actually prescribed there was a 10-10 oil. So 10 milligrams of THC per mil to 10 milligrams of CBD per mil. Again, starting at 1 drop 4 times a day. I have heard of some multiple sclerosis patients responding just twice a day, but we like to spread it out and then we can adjust from there. Every day increasing the dose. So day 1, 1 drop 4 times a day. Day 2, 2 drops 4 times a day. Day 3, 3 drops 4 times a day. Increasing to find the effective dose. And you know what? 4 drops did it. 4 drops 4 times a day. So not a really large dose. And 4 drops is about 0.2 of a mil. So it's about 2 milligrams 4 times a day. Not a large dose of THC. Was able to control her symptoms without further spasm, and there was no further painful tingling in the hands or feet. Resolution in this particular patient. It doesn't always happen like that, but sometimes it can be life-changing, and for her, this is one of those cases. Thank you for your time. Thank you for listening. Thank you once again to the opportunity to be here and present these cases and also the information. I wish you all the best for learning more about endocannabinoids, cannabinoids, and the endocannabinoid system.
Hi, I'm Dr. Orit Holtzman, and I'm the Vice President of the Australian and New Zealand College of Cannabinoid Practitioners. Together with our President, Dr. John Teh, and our directors, Dr. Gal Hertzberg, Dr. Imran Khan, and Maya Lapkovic, I'm very excited to invite you to join us as members. We have founded this college to fill in a very pressing need for standardized education and peer support for healthcare practitioners in the field of cannabinoid medicine. Our vision is to advance the practice of cannabinoid medicine so to better the lives of patients. To join us, go to www.anzccp.org. I look forward to seeing you there and enjoy the rest of the symposium.